Hi, I'm Delphis Richardson. I'm a private practicing pediatrician in Tempe, Arizona, and I'd like to share some thoughts and comments with you about adverse childhood experiences, or ACE. This is an important issue because it has impact not only in the early time frame of the child's development, but even into adult life, as far as the impact of this disorder or this issue with regards to chronic illness and even early mortality, morbidity in adults. It also has impact on our society as a whole because of the dysfunctions that the adults display as related to their early childhood experiences. There are impacts on the family with regards to this that are very difficult sometimes, because as we deal with these in the office, it's a difficult subject to get the parents to open up with. That is an area where we'll have to work at with regards to getting social history. It's one of the things that parents don't often freely relay to you if they're having issues with their spouse, or issues with drug abuse, or issues with being able to interact or interface properly or positively or bond with their child. So we have to be more cognizant of our social history taking and documenting that, so that we don't forget it down the road, and that we can access that and embellish it as time goes on. The challenges on this field really have to do with trying to find a time when you know that something's there that you can try to instigate an intervention of some sort. There are resources available. It's not always straightforward. Sometimes it's a support group. Sometimes it's just being able to get the child into a preschool setting. Head Start is one of the better programs that our country has put into play over the several years as far as early childhood development and getting kids out of a home environment that may be stressful into an environment that may be able to highlight some of the issues that are going on. There are challenges with this disorder because it's just now being really feathered out or really developed fully. This research is often called the most important and impactful research study that you've never heard of. So I would encourage pediatricians, all pediatricians, to look up this research study, read it, and become a little bit more aware of those kind of hidden signs that are there and the impact that they'll have later down the road. The problem with what happens with the child has to do, as I said earlier, with them at that time, because stress and being in a home that is not always a safe place will lead to fear. It will lead to lack of trust within the parent who's on the other side of an abuse situation. It will lead to that parent having fear and not being able to bond well with their child. The whole family dynamics get disrupted. The courts may become involved. Again, a very stressful situation for all families. We have to, as pediatricians, I think, be willing to at least direct our families to where they can get some way to navigate these very difficult and stressful situations. There is no doubt now with this study that those things that happen to children when they're younger definitely lead to earlier, or rather shorter lifespans, more significant adult chronic illness, more issues with mental disorders, more issues with socialization problems. The socialization impacts you actually will start to see in their early childhood, and I would encourage, once again, the pediatrician to get involved in trying to ferret some of the causes for those social delays that they're seeing in children in those early well child visits.